We are a social enterprise which has a mandate to bring about socio-economic transformation in the communities we live in and do businesses in. Our projects are based on transformation, both of the individuals and the areas in which these individuals live in. We have numerous projects that we are working on in housing, in sanitation, and in health, of which this particular campaign is is being tackled under the health sector. On the 17th of September, we launched this Kampala Cancer fundraising campaign with a hashtag, Not Beyond You, in Uganda, Chisoboka. This drive is basically to help procure the much needed machines in our referral hospital in the Cancer Institute. For starters, I need to make this very clear. This we are not doing on behalf of the government. We are doing as a people. We have come out to champion and head a cause whereby we shall pull together the people of Uganda and even our friends outside Uganda to help solve a problem. We have a problem in Uganda currently that every year we register 200,000 cases of cancer, of which every year 40 to 60,000 are new cases. And it is expected to raise in the next 5 years that we shall be having 300,000 patients of cancer every year. Beloved, this is a very appalling number, and it should cause worries to each one who gets to know of this. We did a mini survey, we visited the institute, and we found that most people are dying or are dying of this cancer because of the late detection. They get to know that they have cancer when it has already reached its advanced stages. Our hospital doesn't have the facilities to detect this cancer when it's still small. They can only detect it when it has already grown, and most times there's nothing they can do about it. They can't save a life. So we are fundraising to buy 3 particular machines, some of which that have never been in our hospitals. One is called the MRI machine. It's called the magnetic resonance imaging machine. That machine, it is the one that is used, you see like how they cut a loaf of bread. This machine cuts the tissues of the body and sees up to the minute. So cancer can be detected when it is still so minute, at a point whereby it can be destroyed and lives will be saved. That machine, we don't have it. We want to have it in our hospital. There is the mammography machine, which handles breast cancer. That too, we don't have it. We want to have it in our referral hospital. And the private hospitals that have them, they are too expensive to access. Most of our people cannot afford the private charges. So beloved, together with you, we want to request you to help us support this campaign, to see to it that we procure these much needed machines. And as we do it, we shall save lives. We are saying, let us not focus on one person. Once we procure these machines, they will cover masses. They will save lives. So we call upon Ugandans and request them not to politicize this campaign. This is for the good of the people. Let us not attach it to any political group. It is a non-partisan cause, just for the good of our Ugandans. And our campaign is for $3.5 million, which is close to 12.5, I think, billion shillings. This money will include procuring the machines, building the backers, the places where these machines will be placed at the hospitals, and also transportation and training of the medical officers that will be using these machines. The officers are going to be taken to the UK for training for 1 month, and they're the same ones who come and train others. So all those and all the other operational costs are within the $3.5 million. Currently, our cause is to have these machines put in our major referral hospital in the Cancer Institute. That is where most people come to, and we are going to take handover to them. The schedule is as follows. We are going to fundraise for the first phase up to December 17th, where we shall call upon the public and the media to come and review the collection that we have made. If by the grace of God, December 17th, we have all the money, immediately we shall place in this order, and these machines will be here by end of January for handing over to the Mulago Referral Hospital, particularly to the Cancer Institute. Again, I want to make this clear. We have not been called upon by government or the Cancer Institute to do this fundraising drive. It has been put together because of the cause of the people, because there is a need that needs to be addressed, and we cannot keep on complaining about what government has not done, it cannot do what, complaining will not help us. It will not save the lives that we are losing. I want to bring to your attention, 3 months ago, the Aga Khan Hospital gave 100 patients free treatment in the Aga Khan Hospital, Nairobi. As we speak today, we are left with only 64 of those patients, and still they have not been able to be taken to Nairobi for treatment because up till now, the government doesn't have enough funds to transport them to Nairobi and accommodate them. The government doesn't have money. That's what they say. So what do? Should we sit until all the 100 perish? Because currently 64 are still living. These machines are coming from the United Kingdom, Siemens. So they're coming from Siemens, UK. About government clearing us, like I told you, this is a people's initiative. We are doing it as a people. We are helping government in the long run. We have informed government of what we are doing. Like I said, we are not here to attack government on what it can't do or it has not done. We are coming as a people to help ourselves. We have divided this campaign in 3 phases. Phase 1, which started on 17th September, ends on December 17th, where we shall review. We hope that on that day, we will have all the money collected. But if we don't have it, then we have phase 2, which will be reviewed on 14th February. And if by 14th February, we have not yet collected all that money, then we have the final phase, which will be on the 28th of April, to review. But we are very positive that Ugandans, being lovers of their own people and their nation, we are positive that by December 17th, we'll have this money collected. So that January, as it ends, we just only do a handover of these machines to the Institute. One of the machines, which is called an MRI machine, costs close to $1.5 million. The backer, where they put it, to put it up, costs almost $900,000. We have the mammography, which is close to $500,000. The ultrascan 4D, almost $200,000. Now, that is cost of machine before transportation, installation, training, and these machines will come with a 2-year warranty and servicing for 5 years, plus the training I told you about of the people who are going to be using them.